to fill what they say is a great need by building 3 behavioral health crisis centers throughout the state.
It's a solution to a growing problem that will not only help people struggling with these problems, but could also eventually save the state some money. Reporter Nicole Pineda joins us live in studio to explain.
Any one of us could be just a few steps away from experiencing a behavioral health crisis, and police have been responding to more of these types of calls. But as of right now, these people don't have the right facilities to serve their needs.
It's everyone. Any one of us are a few steps away from experiencing a crisis in our lives. If you think about, the things that we rely on and the relationships that get us through our lives, if that stuff's gone, what happens? Any one of us can find ourselves in crisis. So
people experiencing mild mental illness where the police need to intervene but don't need to be committed or arrested are either taken to jail or the emergency room at this point. Edmunds says both are costly and neither is a good solution for the patient.
First of all, we don't want to criminalize mental illness. I mean, a person that's mentally ill and having symptoms of that doesn't belong in jail. And second of all, emergency rooms are a really expensive way to do it, and it's very exhausting for the law enforcement of their resource because they have to sit there with the individuals, oftentimes in the emergency rooms.
Health and Welfare is proposing facilities staffed by nurses, master-level clinicians, and certified peer specialists, people who have lived through similar crises but are in recovery.
We want to employ them in these centers, so when somebody comes in, that's who they see, is somebody they can relate to, somebody who's gone through this, and somebody that they can rely upon for giving them that solid advice.
One center will be built in Boise, one in Idaho Falls, and one in Coeur d'Alene. Based on what other states have done, they hope to build a facility somewhere near a hospital.
Now, the Department of Health and Welfare still needs to secure funding for this project. They will be presenting it to the legislature in the near future. Edmunds says it is ambitious but also realistic to expect to have the facilities up and running by the end of the year. Live in studio.